Hello and welcome to Bite-Sized MRCP, a manageable way to digest the things that you need to know for your MRCP exam. We are two junior doctors based in the UK who have passed all three parts of MRCP within the last 5 years and want to help you do the same. We are not associated with any MRCP examination organisations, and the materials covered are by no means an exhaustive list of what can come up in your exam, or indeed medical advice. Please refer to your College of Entry or your friendly supervisor for further questions regarding the exam and syllabus. If you like the sound of what you hear today and would like to join us for more bite-sized revision, give us a thumbs up and press the subscribe button. Now, without further ado, let's get into today's topic, which is Listeria Monocytogenes. So, Listeria monocytogenes is found in foods such as pâtés and soft cheeses. It has a relatively low incidence compared to other foodborne diseases, but it is much more severe than others. It has a high hospitalisation and mortality rate. Invasive disease in the immunocompromised and pregnant women can be particularly devastating. So, Listeria monocytogenes is a gram-positive, rod-shaped bacterium, and it causes listeriosis. It grows at refrigerator temperatures. Usually, it affects pregnant women, newborns, the elderly, and the immunocompromised. Transmission of Listeria monocytogenes is through the ingestion of contaminated food products, such as unpasteurized dairy products, deli meats, and smoked seafood. Mother-to-child transmission can also take place during pregnancy or at birth, and there is higher risk in the immunocompromised, elderly patients, pregnant women, and the newborn. Clinical manifestations comprise a flu-like illness in milder cases, but in more severe cases it can lead to septicemia, neonatal disease, endocarditis, and meningitis. Symptoms tend to occur days to weeks after exposure. The management of Listeria is primarily with urgent treatment with ampicillin and gentamicin. Diagnosis may be based on culture from blood, CSF, or amniotic fluid. Prompt treatment is really crucial, particularly in at-risk populations. So now let's try a question. A pregnant woman at 28 weeks gestation presents with a fever and flu-like symptoms. Blood cultures are drawn and initial microscopy reveals gram-positive rods. Which of the following is the most appropriate next step in management given the suspicion of listeriosis? So our options are as follows. Await culture confirmation before initiating treatment. Start empirical treatment with ampicillin. Administer a broad-spectrum cephalosporin, prescribe oral azithromycin, or initiate treatment with vancomycin. Now, you'll remember from the presentation that it's really important to start treatment with ampicillin, and it's also important to consider in the MRCP exam as well which particular drugs are safe in pregnancy. So through that, you can automatically eliminate some answers even if you didn't know the answer to this particular question. But as it happens, the treatment of Listeria in pregnancy would involve ampicillin. Thank you for listening to this episode of Bite-Sized MRCP. If you like what you've heard today, give us a thumbs up and hit the like and subscribe button below to make sure you don't miss our next episode. Let us know in the comments which topics you would like to hear in future. See you in our next episode.